Hello friends, my name is Dr. Amit. I am the consultant orthopedic surgeon at SundaramMedicalFoundation, and today we will be talking about knee pain. Okay, so knee pain is also one of the top three reasons which brings patients to my OPD, and patients present with knee pain at all age groups. Right from the really young to the middle age to the elderly, and the causes for knee pain I find them to be very different in different age groups. So the younger patients, usually they present with some kind of an injury, I was playing something and my knee buckled, or I fell down and hit my knee somewhere, those kind of symptoms, and they'll usually come with a short history of acute knee pain. The middle-aged patients, usually they present with just near short onset arthritis, where they had a few days or a few weeks where they've started developing knee pain, and it's not there all the time, but on certain activities like climbing up stairs or getting up from kneeling down, and they're just starting to develop the knee pain, which is sort of a slow burn and chronic in nature. And the third category is usually the elderly, our senior citizens, who usually come with pain related to arthritis, just wear and tear, over the years, keeping on using the knee, and the pain has been there for a few years to a month and is getting worse with time. So that's the kind of presentation that I get in different age groups. And the treatment is based on, again, the reason for these back pains. So like I mentioned, the younger patients, the sports injuries usually are either trivial in nature, where you just have a little bit of a ligament strain or just a soft tissue injury, or you can have injuries which are significant, like a ligament tear, like an anterior cruciate ligament, or what we call ACL tear or a PCL tear. Meniscus injuries, menisci are like the cushions in the knee which prevent the two bones from knocking around each other. So the menisci, when they tear, those flaps can get trapped in the knee and cause pain. So that is usually seen with sports injuries. In middle age, you usually see early onset arthritis, or what we see chondromalacia, where the softening of the cartilage happens because of poor nutrition, sedentary lifestyle. You've done your active years are over, and now you're spending time in a corporate job or sitting on a chair all day and working, and slowly the age is catching up with you. These usually respond very well to exercises like physiotherapy and strength building, resistance training, and sometimes supplementation in case there is a nutritional deficiency. Some of them usually present with first early onset inflammatory arthritis, like rheumatoid arthritis, which will present in usually the third or fourth decade of life. And these can, unless they are treated properly, they can actually worsen really rapidly, even to a stage where the joint gets completely destroyed. However, if picked up early, they have very good treatments available, and medically they can live a very normal life provided it's picked up early and treated well. The elderly usually present to us with something which is called osteoarthritis, which simply means degenerative arthritis. It's like running a car, for 10, 20, 30,000 kilometers, how the tires wear out. Just like that, over time, because of physical friction and entropy, the knee cartilage and the knee joint wears out, and then it becomes rough to walk on, and every step becomes painful. So in early stages, these can be treated non-operatively with medication, physiotherapy, and there are some joint injections that we give for treating them. But in very late stages, where the cartilage is completely worn out and you've got a bone on bone contact, they do very well, exceedingly well, with knee replacement. Again, this is not reserved for everyone, but particular cases selected and treated and not responding conservatively to non-operative treatment are very good candidates for this surgery, which has a very high success rate in carefully selected patients. Thank you.